Good evening, Doctor. Thank you for accepting our proposal for this interview. We are glad
Okay.
to get an interview from you. We would like to introduce ourselves. I'm Yumendran. My matrix number is 004 DIN 2F 2011.
So my name is Kong Mei. My matrix number is 04D20F2006.
My name is Rishi Ramas. My matrix number is 01420F2014.
We are from Commerce Department. Before we start our interview, can you introduce yourself, Doctor?
Okay, my full name is Dr. Aravinda Jyoti Subramaniam. I'm a GP in Johor. I have my own practice.
Okay, now, if you don't mind, I would like to ask you some questions regarding to our assignment. Can we?
Yeah, sure can.
Okay, first of all, as a doctor, how many years you are working in this field and what kind of duty you serve?
Okay, I was in a government service for about 6 years. Okay, now as a general practitioner about 8 years.
Oh. Okay, next. Can we know since when you are serving as a doctor after finishing your
Since
studies?
2016. I graduated 2016. Yep.
Oh. Okay. Would you like to share us any inspirational word that you listen and carry out through your life and career? Like motto.
Motto. That's a very hard question. You should never stop learning. Like that's the wise word that my father passed it to me. Okay, so education is something that it doesn't stop. I mean, after I become a doctor doesn't mean it's already end of my studies life. So I can still further studies further studies. So that's my wise word lah. Don't stop studying.
Don't stop. Okay. Okay, every individual has a specialty in their career. So what do you think that you are in special in this field?
I mean, what specialist I wanted to be, or
Not you are special or something or master in something. Like somebody,
not
she is special in dentist.
okay. I did my actually subspecialize in dermatology, skin.
Oh, skin. Okay.
Yeah.
Okay, that's all from me. Next, I will pass to my group member, Kong Mei.
Okay, sure.
Thank you, Yubi. So my first question is, what is doctor's job description in Takaful industry has a doctor position?
Sorry, repeat your question.
What is doctor job description in Takaful industry has a doctor position?
Takaful industry. Takaful, you mean it's a
Insurance.
insurance industry, is it?
Yeah.
Yep.
I mean, how we are helping with the insurance, or how? I don't get it. Okay, I mean, as a doctor in a GP, we don't involve in a lot of insurance cases unless you are a doctor in an insurance in an insurance company. I mean, let's say you're a doctor for the Great Eastern, is different things. But as a GP, I mean, it's more of a normal medical claim. So we don't really into this insurance things.
Okay. So next,
Did I answer your question?
Yeah. But this all question fully is Takaful industry.
Okay, Takaful is a insurance company. I mean, they cover a lot of things. It's not only for the patient; it's also for your property and all those things. So it's just like, usually what patient does. Okay, let's say there's an accident. Patient comes to me and he has a Takaful insurance. It depends on his claim. So he will bring me a form for me to fill up.
Okay.
Okay, so we will fill up and pass it to their insurance agent for them to proceed with their insurance claim.
Okay.
But we don't certify whether this guy is suitable for the insurance claim or he doesn't need the insurance. So that's not our part. We just basically just write, I mean, you just fill up the form for them. Why he
Oh,
came, what's the medical problem, what are the diagnosis, what are the medical treatment given to him. So whether we referred him to the specialist center or we actually follow up the patient for the dressing and all those things, and how was the final what happened at the end, whether he recovered or he had a disability or he can't go to work. That's the only thing we're gonna give to Takaful. The rest of it, the Takaful will take care.
okay. So next, did you have any rules needed to follow? Can doctor tell us about the some rules?
Say about the
Rules.
rules.
Yeah,
Okay, rules for the Takaful, is it?
yeah.
Okay, basically we have to submit all the documents that we provided to the patients. I mean, what are the MC given? I mean, how many days MC? What's the MC's number? What's
Okay,
the charges? And these are the rules that we have to follow when we submit the insurance form.
okay,
Okay, but there is no, I mean, it's not like strict rule from Takaful, you know. That's why I said
okay,
to the GPs, they don't really give us any guideline. What are the things that you should do?
okay.
Mm-hmm.
So my third question is, what are the reason doctor involved in this career?
In an insurance, is it? Or in I become a doctor?
In insurance.
Okay, basically because most of the patient, they don't straight away go and see a specialist. Usually they see a GP doctor first.
Okay,
Okay, so and then GP will assess whether this person need a further follow up at the government center or even need to be referred to the specialist center or not.
mm,
Okay, so GP's role is basically to determine whether this patient need a further follow up or we can treat him. I mean, if it's a dengue case, it's just a mild cough and flu. A normal GP can treat. He doesn't need a referral to the specialist.
okay,
Okay, so that's why we actually stop our patient from uh unnecessary. We call it unnecessary insurance claim lah. So we don't want all these things to happen. So this is one of the roles. So we don't want the. I mean, for the simple minor things, they don't need a specialist referral. So we will treat ourselves and then we'll tell them, okay, this is just a normal gastric pain. So he doesn't need a scope. So he can just go for medical treatment. So we'll just stop referring him to the specialist. So that's why actually GP comes in as into Takaful.
okay. Is it doctor like has Takaful player?
Doctor's life as a Takaful player.
Yeah.
Not not directly. Not
Okay.
directly. Unless you are a doctor, panel doctor for Takaful, then it's a different. I'm not a panel doctor.
Okay.
Yep.
So my sixth question is, did doctor have any experience as Takaful player and share some cases that doctor had handled before this?
Okay. Takaful, um okay, if I'm not mistaken, Takaful cover for their family members as well.
Yeah,
I'm
family.
not very sure, but yeah, they actually cover for this family members where actually the father actually the son had an accident. So the insurer is actually the father. So he came to claim for his son for the medical treatment. But it was just a normal abrasion wound where we did a dressing at the clinic for a few days. So that's why we just submitted the form. So the father claimed for the son.
And then my final question is, what is doctor's opinion as a Takaful player?
Um, okay, we mainly give, I mean, okay, we are the frontliners for the Takaful insurance. Okay,
Yeah.
so the patient come to see us. So we are the frontliners. We screen the patient whether this patient need a normal treatment or whether need a referral. So and then if we need a referral, and then we refer to the hospital which actually cover for the Takaful insurance, because not not all specialists actually accept Takaful insurance. So we have to find out which hospital actually accept that and then refer the patient accordingly.
Okay.
Takaful, yeah,
Okay, sorry.
yeah.
You can proceed. Madam, you can continue.
Yeah. Oh yeah, that's all.
Oh, that's all okay. Thank you for answering my question, doctor. So I will pass it
Okay.
to Reshwini Ramas.
Okay.
Thank you, Kong. Okay, doctor. Is there any complicated cases have you solved?
Okay. Yeah, generally or it's just for the Takaful insurance?
Takaful insurance.
Okay. Most of the cases that we see is actually those cases which actually required a surgical intervention, like appendix. Okay, so we diagnose, okay, this is appendicitis, so we refer to the specialist center for the surgery. So other than that, it's all accident cases where needed admission or further care from the specialist, like, fracture, you need to get admitted. These are the two main cases that we have seen. Rest of it is a common cold, but common cold, dengue cases, confirmed dengue cases, yeah, we refer to the specialist. But
Okay, doctor. My
complicated
next.
so far under Takaful, no, I haven't seen anything.
Okay.
Okay, my next question. If any accident happens, for example, if there is an employee had a minor accident at the workplace, can Takaful claim the case?
It depends whether, because there is a two, you have to consider two insurance when it's come to the workers, because most of them have their SOXO.
Okay.
Okay, so if the workers is going under SOXO claim, he cannot claim his Takaful. Okay, but let's say he wants to go under his Takaful, that means he's not eligible for the SOXO. So usually when once come to the workers, the worker have to decide whether he actually want to use a SOXO or Takaful.
Okay.
Because you have to know that all the original documents, okay, like our medical sheet, our medical certificate, all those things, you can only use in for the one insurance company. So we won't provide another original medical sheet or another original medical, for the claim. So they can only claim one. So if the worker said, no, going for a SOXO claim because he has some disability after the accident. So he wants to claim is a disability due to the workplace injury. So he'll go for SOXO claim. So they won't use their Takaful.
Okay.
So this
So
Takaful
what is
usually, yeah, it depends on the insurer whether he wants to use his SOXO or he wants to use his Takaful insurance.
okay, doctor? So what is your professional opinion on Takaful?
I mean, so far no issue with this insurance because they cover for their kids also. Not like other insurance where you have to pay separately. So individual insurance. But this Takaful is actually for the family.
Yeah.
Most of them, usually if let's say the father is paying, the kids also covered as well. So this is one thing that I know that Takaful does lah. And it's more of a Islamic way.
Yeah.
Okay, so it's actually preferred mostly by Malays actually.
Okay.
So I never seen any Malays, any Indians or Chinese with a Takaful. So most of the time it's actually Malays.
Hmm.
Yeah.
Do you have any experience giving medical reports for Takaful claim?
Yeah, I think the one that I can remember is the father who claimed for the son who had the accident.
Hmm.
Okay, thank you for answering us patiently all our questions despite of your busy schedule. We are looking forward for our next session with you.
Okay,
Thank
sure.
you.
Thank you,
You
doctor.
Okay,
Thank you.
okay, take care.
Okay, thank you.